Hello everyone, this is Patricia with Mental Health Matters, and you can find me on YouTube with A Slice of Peace with Patricia. All right, tonight we're going to continue our discussions about relationships and mental health issues. For those of you that have been following me, you know that I've been talking a tremendous amount about trauma, whether it happened in childhood, early adulthood, or even last week. Trauma is something that we take very seriously. And I want to give you once more a definition of trauma. It is a very distressing and sometimes chronic event that happens on a mental and psychological and emotional level that seems to always have negative consequences. So the question that I've been asked for tonight is, should I share my mental health issues with my relationship? Okay, so the unhealed trauma has definitely some characteristics to it, meaning the individual has suffered a trauma, either, as I said earlier, from childhood or from something as current as a car accident or chronic illness. It could be that you lost your home, you lost your job during COVID. It could be a divorce. It could be abuse from childhood or adulthood in a marriage. It could be verbal, emotional, even physical, sexual abuse. All of that falls under the heading of trauma. And if it has never been healed, in other words, you've never gone into counseling or talked to anyone about it and tried to make sense out of it, it is certainly going to show itself up in a close, intimate relationship, even inside of your friendships, and it may even show itself up in the workplace. So let's go over some of the signs and symptoms of unhealed trauma and why it's important to identify some of these symptoms and talk about them with your partner. So I don't subscribe to talking about this on your first date or maybe even during the first month or two. But there will come a time when you will have to sit down and have a serious, honest, and open discussion, communicating some of your mental health issues, which we all have, whether it's been anxiety or depression or even mood swings and the bipolar issue. I think it's really important to share that with the one that you say you love so that they can understand and help and support you during maybe some stressful times. So coming back to trauma, these are what we know to be true about those that have suffered trauma and have received very little or no treatment. Number one, low self-esteem. A lot of our patients that have trauma really have low self-esteem. They don't think about themselves in positive ways, and they have a lot of that negative self-talk going on all the time. Number two, we know that inside these relationships there are usually codependent types of issues that are very obvious and very apparent. The individual that has suffered trauma leans very heavily on their other partner, and after a while they become enmeshed. The individual with trauma doesn't seem to know what he or she is about and kind of is looking for the other person to fill in all of those spots. So codependency tends to be very, very large and looming in a lot of these relationships. Number three, the individual who suffers trauma has a very difficult time standing up for themselves. They allow people to push through their boundaries, and they have a very difficult time in saying no. So they're very overly agreeable. Another issue is that they really have a low tolerance for conflict. So many times they become the peacekeeper, put that in quotes, in the relationship. They will do anything to keep the peace. Due to their history of trauma and perhaps abuse, they can't tolerate anyone feeling uncomfortable around them or creating any conflict inside that relationship. So they say yes a lot when they really want to say no. They're always having this feeling that the other shoe is going to drop. No matter how happy they are and what joyful moment they're experiencing, in their mind there's a lot of anxiety, and it's always targeted to, oh, this can't last, this isn't really for me, I can't really be happy, and so I'm going to sabotage this event and make it miserable for everyone around me. And so they can't enjoy the happy moments. And they're always waiting for something negative to happen, that other shoe to drop. Okay? They really resist any kind of positive change. Again, that goes back into why bother, low self-esteem, I can't be successful, I can't lose the weight, I can't get the job, I don't get the good guy, and the list goes on. Resisting changes that are very possible, but in their minds, not for me. They have a deep fear of being abandoned, so breakups are extremely hard for our trauma victims, and they avoid breakups. So what that means is they stay in very unhealthy relationships or marriages for a very long time, because the fear of being left and being left alone sometimes feels just too overwhelming. They also put aside their own needs for the needs of their partner. And so after a while, like in all codependent relationships, they do a lot of the giving, and they give, and they give, and then they resent. And we call that the dance of codependency. So again, with low self-esteem, they really don't know what they want. They don't know what they believe. They don't have a clear picture or image of who they are and their place in the relationship as well as their place in the world. So again, that's a difficult place for anyone to be. And last but not least, they really have a high tolerance for abuse. So again, these unhealed trauma patients or victims or people stay in abusive relationships way too long. So they tolerate verbal abuse, mental abuse, physical abuse sometimes, and it's very hard to break through that they have other much more positive alternatives and choices to make. So if you or someone you love has experienced some of these signs and symptoms of unhealed trauma, the solution is certainly to get into counseling and therapy and also talk to your doctor. There are medications that can help with anxiety, as we all know, and also mood swings for our bipolar patients. But in terms of trauma, there is no specific medication. Talk therapy, sharing the experience, sharing the feelings, going back in time if needed, and bringing it all up once again so that that wound can heal is really the best part of the solution to this. And in time, that wound will heal. You can't just simply put a Band-Aid over trauma and think that you can shove it down and forget about it. This is what really exacerbates a lot of our mental health issues, as well as substance abuse and addiction. Underneath that is always emotional pain, and that pain has to be brought up, resolved, and then hopefully, it will kind of de-intensify. So it will have a life, and then you'll let it go and you'll make peace with it. And that's what I hope for you. So if this has been helpful, this is how trauma and mental health, they kind of blend in together with your relationships. And you can't run. There's no way around these kind of issues. You've got to walk through them. And I hope that you're able to do that with a good therapist or a good minister or whoever you go to for your spiritual advisement, even a sponsor perhaps. but most importantly, that you work on these issues for yourself to have a healthy, whole, loving relationship. Okay, I hope this has been helpful. I know I've gone on a little bit too long, so I'm going to stop now. This is Patricia with Mental Health Matters, and also on YouTube, A Slice of Peace with Patricia. Please pass this on to anyone of your loved ones that you feel may benefit from this video. I want to stay in the solution. I've outlined some of the problems, and let's get into the solutions of having a healthy, whole, and happy relationship. All right. Thank you, everyone, for following me. I so appreciate your support, and I'm going to keep on coming back. We're going to, again, talk about relationships and some other topics that are coming to me through your questions. So thank you so much, everyone. Have a great night, and I'll see you real soon. Bye for now.